Welcome to One Health Wednesdays, where all health connects. I'm Dr. Ginger Dixon from One Life Epi Solutions, where we're dedicated to breaking down the silos between health disciplines to address our world's most pressing challenges. Whether you're in public health, medicine, veterinary science, wildlife management, or environmental conservation, this podcast brings you insights that bridge our collective fields. Each week, we bring you conversations with thought leaders and innovators who are applying One Health principles to create sustainable solutions across the globe.
This is Dr. Julia Zammit, and I'm welcoming you to our One Health Wednesdays. I'm the guest host, replacing Dr. Ginger Dixon, and I'm having a small catch-up conversation with Dr. Dauda Onawola. We'll start in a few moments and just have a brief pause for our sponsor message.
Concerned about the future of public health and our planet? One Life Epi Solutions has the answers. Introducing the One Health Playbook, your free guide to integrating One Health into your organization. Inside, discover actionable strategies, data-driven insights, and frameworks for powerful cross-sector collaboration. Learn how to streamline data collection, create impactful educational materials, and make a real difference. Download your free copy of the One Health Playbook today and start building a healthier tomorrow. Visit tinyurl.com/OHORG Playbook. That's tinyurl.com/OHORG Playbook.
So, hi, Dauda. We've already said you don't mind being called Dauda directly. So, how have you been the last 3 years since our podcast has met you 3 years ago? What have you been up to since then?
Hello, Julia. It's a pleasure to be here again. My name is Dauda Onawola. And yeah, of course, we had an episode earlier on, like 2 years ago, where I talked a lot about my organization and more about my passion for One Health and what gave birth to it. So coincidentally, in the past 2 years, a lot has happened. I've been largely into wildlife practice as a field veterinarian, and I also managed the Zoonoses Education Campaign in Nigeria. And since then, we've managed to actually implement some projects at the One in Action initiative. The last time we spoke, we were still like really, really just starting, but now we have some numbers that I'd like to highlight in the course of our discussion. Thank you very much. All right. So, speaking about, my experience in the One Health direction in the past 2 years, I think one thing I've learned is, One Health is a little bit wider than many people really think. Thinking of it from the components might be a little bit too restrictive. You have to think of it from the approach point of view, which means that, when you have a problem, then you have to widen your horizon and thinking about the solution and be inclusive enough to make sure that you understand all of the biases, not just the technical part of it. I'll give an example, a case study to buttress my point, but then, to take care of the biases and also make sure all stakeholders are eventually, happy with the solution you're building and they really want to key into it and help you solve the problem. All right. So, and when I was a field vet in the wildlife space and also managing the Zoonoses Education Campaign, I discovered that there are multiple causes to all the wicked problems that we know. Well, of course, which is the attributes, but then these causes are actually inherent and also they have biases to them. For example, if we all know that, consumption of wildlife, hunting of wild animals, deforestation are things that predispose the human population to spill over to zoonotic diseases, what's known and unknown from, from the wild into human populations. But then when you now reach out to people to tell them, you would expect that speaking to anybody about the risks, the health risks associated with, having undue contact with wild animals, they would want to just, on their own understand and induce some behavioral changes in themselves, but that is not the case. Then people start to bring up issues like livelihood, the culture. Some people, they don't hunt and eat bushmeat because it's food or because they want to sell it or something. They're doing the hunting and bringing it to the table because it's part of their culture. Their forefathers did this and they can't allow the legacy to end on them. So now, how do you convince this kind of person to stop hunting and killing bushmeat? Meanwhile, whether it's cultural, whether it's economical, whatever reason you have to go into the wild and island, you contact other animals, the health risks, the risk of you contracting a zoonotic disease is always there. So how do we now, deal with all these biases? So that is what I've been up to. And, as it sounds, it's been really, really interesting, in interacting with the indigenous populations around wildlife sanctuaries and with the general public and, dealing with different demographics and what they understand and how to change their behavior and their perception about some of these other topics. So yeah, I've been up to quite a number of great things, interesting things so to say.
It sounds like a very bottom-up approach, which is something that we like to shout about in One Health. So that's quite exciting.
Yep.
Do you also do you have nomadic people or marginalized groups as well in Nigeria and the areas that you work in?
Yes, of course. So switching from the wildlife to what I do right now, I basically manage some online education programs for veterinary professionals now. Mm-hmm. And when you talk about, farmers, nomadic groups, veterinary paraprofessionals, community animal health workers, that's an entire socioeconomic, do I say scenario or domain on its own? Because, because these are people that inherently, they have businesses associated to what they do. Whether you're keeping livestock for, because you met your grandfather's keeping it, or because you're doing it as a small scale or medium scale business, then as you eventually want to make something out of it, whether you're using as shock absorbers for economic emergencies or you are actively into it for business, you're into it for some economic gains. And when you're into livestock production, for example, it's an entire value chain. We have input providers from the drugs, feed, healthcare service provision to the point of production where you're actually going to, rearing the animals, feeding, giving them the feed and all of that. And down to where it gets to the consumers, so this is an entire, domain on its own with a lot of factors and biases. And that is essentially what I do now. But then just to, not to digress, but to speak about like a few things that we've been up to an action initiative. And, how I'd like to talk about how we are contributing to the solutions.
Ideally, yes, you are contributing somehow, which I can hear you on.
Yeah, exactly. The thing is, one organization or one entity may not really solve the problem, but if we all bring our bits together, we can build solutions that would be sustainable and will really, really resolve the main issues, right? So, well, since the time we met, we had a program on Zoonoses Education. We call it the ZCard project. And by that, what we're simply trying to do is to break the information barrier or the communication barrier between, science and the general public. That was consolidated in my experience while managing the Zoonoses Education Campaign. By the way, I reached over 6 million Nigerians with the Zoonoses Education Campaign. So I think that's noteworthy.
Definitely noteworthy. Wow.
Yeah. So what Yeah, what the ZCard basically does is try to, bridge the gap between science, the knowledge, and the people. And what we do is we put up infographics about zoonotic diseases, and then we share widely on our social media, not just for the primary audience who are people that will get on LinkedIn, Twitter, Facebook here and there, but we want them to also, post it on their, for example, WhatsApp status and let their family members, for example, who are not scientists, people that don't really know so much about these things, to read through these infographics and see what they can do to protect themselves and to prevent zoonosis from, getting into them or spreading within their population. The issue of zoonotic disease is very important because it has economic. We'll talk about the economics of one later on, but it has economic impacts when you, from the big picture perspective, when there are outbreaks here and there of disease that jump from humans to animals, then the government, non-governmental organizations, international NGOs, then their attention shifts towards that, and they are unable to really use their resources on developmental projects or focus on sustainable development. That way, the outbreak of zoonosis is dragging these institutions backwards on advancing sustainable development. So that is simply the economics to zoonosis, and that is why we think, okay, it's important for us to let people know how on their own they can prevent the spread of zoonotic disease. And we are close to having 40 ZCards being published, and once we clock 40, I am using this opportunity to announce that we have a very, very big gift to people that have been using our ZCards. And yeah, so we are planning on a contest for people to use the ZCard, and then the best person is going to get something. So that's all I can say for now. But yeah, consider this backdoor information.
A little bit of a sneak peek into what you're also doing in the future. So you've become really good at science communication. From what I can hear in the last 3 years, it's really propelled forward. And I'm always extremely, flabbergasted, I would say, that how people in Africa, and I can see, the engagement on LinkedIn and other social media platforms, people are really excited about One Health in Africa and in Asia. And I'm always a little bit, maybe it makes me a little bit hopeful for maybe Europe and the States as well, and the other around the world, other continents, because sometimes I talk about One Health here because I live in Europe, and I just see people looking at me, anyone from any other science apart from maybe veterinary health, maybe don't really know what One Health is. And then I see how people engage in your part of the world, and it's so exciting. Do you understand why people are so into this multidisciplinary, interdisciplinary field much more than maybe we are in our part of the world?
All right. Yeah, I think I have some answers to your question. So I'll give at least 3 of them, which I think should suffice for the scope of this call. The first thing is, I think it's a positive thing for us in Africa that with the popularity that One Health is gaining, we are now getting to understand that some socioeconomic problems can be solved with the One Health approach. And, that is basically the potential that a lot of people are seeing in the One Health approach that's driving them at it. And that's why everybody, wants to really be engaged in it. And as I said in our first call, we all have to understand that there are so many things you can do that will eventually yield results that have One Health implication. Whatever you do that has positive impact on human, animal, and mental health, qualifies to be called One Health, right? So that is the first answer. And that would lead me to the second response I give to that question, which is um, a boarding approach. I call it boarding because it's a very new term coined by a senior colleague, one of my mentors, Dr. Shehu Shamsuddin, one entrepreneurship, right? So we are beginning to understand in Africa that there is a business side to One Health. It's not just about, putting forward the concept of human health, animal health, and environmental health being closely linked together. It's also about, for example, the nomads, the livestock keepers. When antimicrobial resistance, we all understand it's a One Health problem, right? Vaccination has a One Health side to it because it helps to prevent disease. And if it's zoonotic, then you're stopping it in one species and it can get into another. And climate smart agricultural practices that reduces methane emissions. So all of these are, One Health issues, right? And then when you now look at the cost benefit, because One Health economics is all about approaches that gives you the best result when it comes to cost benefit and cost effectiveness, reduces what you spend and then gives you maximum outputs that are, beneficial to humans, animals, and the environment. So when you put all of this together, the local business, the socioeconomic impact of One Health is beginning to come up. And then when you look at One Health from that perspective, you're talking about people, profit, and planet. I don't know if profit should come last so that we, we don't prioritize profit, but yeah. So, and when you do businesses, airline operators, this and that, you have to put into consideration that, okay, yeah, there are these local businesses and there are things you can actually do to support them. It doesn't have to be like a livestock institution funding a climate smart agricultural project, for example. Whatever you do, you can support this businesses, and then because in the end, whatever they do also affects you. If food production goes out and we suffer to get food, of course, the price of plane ticket will increase. Ask me why? Because they serve meals on the plane, and who produces the meal? Farmers. Yeah, do you want to eat chicken in your restaurant? Yeah, everything starts to get expensive on day-to-day basis. Why? Because the farmers are, having increasing cost of feed. And that is because, so everything is basically linked together and people are beginning to see it from this perspective, right? And lastly, so since we have established the One Health in Action initiative, we've engaged close to 2,000 youths directly and then virtually, of course, and all of our social media accounts, we have about 12,000 followership, and then we have numbers on our project. And as we speak, we have opening for 4 volunteer positions. We have 370 responses, people wanting to work with us. Wow. So what I've discovered engaging youth in Africa is that the opportunity to really learn about the concept of One Health and how to really implement it is something that is needed. So anytime we put anything up that has potentials to impact knowledge or skills on youth on how to implement the One Health approach, they tend to, always try as much as they can to be part of it. So, which is to tell you, of course, One Health's knowledge dissemination information is really, really, really something we also have to look at. And, given all these numbers, it's now on us to try to scale up our activities to serve more people. I mean, the numbers now, there's a lot of deficiency. We have, tried to host webinars and talks and podcasts and give information out. But we've only been able to really reach and prove 2,000 people, but we have 12,000 people following us. We have 370 people wants to join us for 4 positions now. I don't know how we're going to go about that. So we need to, expand our capacity to be able to really teach people more. And then lastly, the deficiency in terms of socioeconomic development in Africa that I see now with regards to One Health is the implementation side of it, right? So if we teach everyone, the knowledge is out there, then we must have bridged the gap between knowledge and the people, or information the people will eat. We will now be left with bridging the gap between the knowledge, the science, and implementation. And that is where we are driven at right from the onset. And if you recall, most of our projects have at the core of their concept implementation. For example, our past podcast is basically people that have implemented, programs that conform to antimicrobial stewardship, or that have done successful massive awareness campaigns on antimicrobial resistance, or that have conducted research on AMR using the One Health approach. These are the kind of people we host on the past podcast. And this is the same for One Health scenarios. It's the same for our upcoming African Youth Dialogue on One Health and Sustainable Livelihood, which, of course, that's the 3rd edition. I forgot to mention that. And this time I want to go as big as possible with it. It's going to be virtual, but our plan eventually is to be able to host it live and incorporate some unique things like, skill acquisition sessions or capacity building sessions where our participants will be able to learn 1 or 2 things. And when they go back to their countries, they will that will be my response to the question you asked about why One Health is really moving forward in Africa, so to say.
Yeah, I'm actually was thinking while you were talking about the youth as well, and I also have this feeling that in Africa, people are much more connected to their environment and to their animals. So that also could be why people really want to create change, and maybe even that's why it's so maybe not easy, but easier to engage youth in the One Health space. Do you find that people that you engage with tend to be veterinary students or young people in general from different backgrounds?
Yeah, it would be interesting for you to know that we now engage people across all disciplines. In the beginning, our team was purely veterinarians. Globally, there's a trend that vet doctors are like the champions of One Health and pushing it forward. But now we have human medical practitioners in our team. We have the mechanical engineer in our team. We have people from all sorts of professions. So
that's amazing.
It's generally young people. Yes, generally all people want to make changes happen in their space. That is one thing. And secondly, I agree with you. I think it's because, humans are closer to the environment here. And how do we define that? Well, technically, I will tell you that's where biodiversity comes in, because Africa is rich when it comes to biodiversity, significantly rich. And when you now talk about One Health and the impact of human activities on the environment, it means that you're talking to a population that is readily seeing it. For example, if I talk about the extinction of a species of tree or deforestation, people in, say, Cross River State in Nigeria will understand absolutely what I'm talking about, and some parts of Congo, because they're seeing illegal timber dealers. They're seeing people just come to cut their trees every now and then they are experiencing increased temperatures in hot parts of the year, and that is to tell them, okay, if then somebody comes to tell me the trees they are cutting will cause the temperature around me to increase, and I'm seeing it increase, then he's saying the truth, because what he said has happened and it's happening. How can I stop it? So you are appealing to it makes sense to them. So you're appealing to their sense of reality, what exactly is happening to them. And Africa, it's good we have a vibrant youth network in Africa. The thing is, we have, when it comes to One Health and biodiversity, we have a lot to lose.
Yes.
Because, of course, we have a lot of regions with unique wildlife that you can find therein, and they have implication on humans and domestic animals, and overall we all have what we do to the environment, and whatever happens to the environment in the same vein affects us as well. So and beyond that, if we go to the One Health economics that we're talking about now,
Yes.
I just gave case scenarios of where One Health problems affect livelihood, antimicrobial resistance, wildlife, livestock interface, livestock production, and so on and so forth. So all of these things, their implications is felt on the One Health triad, right? So if we don't come together, if youths in Africa don't come together, these are the essential things that development is built on. The micro socioeconomics, like common people, how do they get food on the table? Everybody wants to eat, but then how do you do that in a manner that you don't send antibiotics to their graveyard too early? How do you do that in a manner that you don't produce more greenhouse gases than you should, and so on and so forth? So that would also be the second reason why, the One concept and the approach appeals more to African youths than probably, and that is not to say that the other continents are not equally, engaged in the One space. I've met with people from like all the continents except
definitely.
of course,
definitely.
and they're all geared up. They really want to do something because they also have rich biodiversity, and they have like economic programs that are linked with life, and they also want to build upon that. As a matter of fact, I must commend the efforts of South Americans and the Asians when it comes to One Health. They are also implementing very, very interesting projects there and engaging youth in amazing ways that we also hope to learn from and engage African youths in such pattern.
And I mean, talking about economics, we're starting to see how zoonotic diseases are affecting people on a day-to-day basis. For example, highly pathogenic avian influenza in the US, where eggs have become extremely expensive because of the consequence of avian flu. We've also seen FMD come into Europe again, and there's huge outbreaks and a huge economic loss across Central Europe. So I think this is something that will maybe start causing more engagement, unfortunately, with the detriment, because people are seeing the problem directly in their lives, that these are issues that people need to deal with. And it's not just, the maybe only people who work in health, but also people who work in other sectors, and they're feeling the issues, not only zoonotic diseases, but other animal health diseases affecting them on a daily basis.
Yeah, I agree with you excellently. I mean, it's a very complex chain, and when you attack just one point, it affects like every other thing. It's a complex cobweb, and like you rightly said, so the economics of One Health is basically how you apply economic principles to you optimize health outcomes. And one thing with it is that cost benefit and cost effectiveness is being analyzed continuously and rapidly to make sure that we understand the economic implication of these problems. And just like you've mentioned now, zoonotic diseases, antimicrobial resistance, at the very least, what they do is they drag resources with other priorities at local, national, international levels, such that you have to spend more that should have gone for other things. Yeah, you have to spend more in trying to curb them, trying to control them, and try to mitigate them and reduce their impact. Because if you don't do so, when these problems escalate, they lead to irreversible damages. So we are at the point where everybody is beginning to understand that, of course, it's a little bit too late, but also a little bit too early. When you regionalize the issues, in some places it's a little bit too late, in some places a little bit too early. For countries where, because in the past 12 months, look at it, highly pathogenic avian influenza came out in multiple species in many countries.
It's scary.
Yeah, it's scary because we at some point, some scientists were projecting that we might be looking at another COVID-19 scale outbreak of highly pathogenic avian influenza, and the fact that it's zoonotic makes it scary. And even if it's not, having direct health impact on you, the fact that you have to pay more to get eggs, to get poultry meat, and that is already something, because you need animal protein to have a full complement of amino acids that you need for the blood, especially for the kids. So you might have people having malnutrition if this is not controlled. And for example, in the case of FMD, of course, it reduces, aside other symptoms that it imposes on affected, cattle, it reduces their milk production. So the dairy industry begins to suffer as well. So, how all of these things link to the economy of a state, of a country, is really interesting. And that is the reason why, we are shifting more towards economic and implementation side of One Health, rather than, preaching the concept always. And to end that, I would like to say that, in my opinion, we saw highly pathogenic avian influenza coming.
I agree.
And so and same with most of the outbreaks now. But if we didn't see it coming in particular, this is the reason why we have, I don't want to use ZCard as an example so that it doesn't look like I'm biased, but this is the reason why we have a lot of people and organizations trying to put up awareness, trying to bridge the gap between science and the common man, trying to bridge information gap regarding the outbreaks of zoonotic disease. Post COVID-19, there was lots of investments going into, public education about zoonosis prevention, and disease control in general. So, and well, to be fair, the authorities that were engaged in this, I think that they really did a good job to let the whole world understand that COVID-19 may not be the end if we are not careful. And during COVID, we saw what it did. Lots of businesses had to crash, and a lot of people had to go hungry and all of that. Even if it's near, posting on social media and whatnot, these authorities have really done a lot. And, there's lots of researches that went on, and they did so much to inform us to be warned. But, maybe we listened, maybe we did not. Time will tell. Moving forward, what I'd only, say and recommend is when the local health authority in Nigeria, for example, we have Nigeria Center for Disease Control, when they come out with warnings, when they come out with infographics regarding disease outbreaks and how to protect yourself from all these diseases. And there is something, maybe in a third episode when you host me again, we'll talk about neglected tropical diseases and that alone. That is also something, that is also something massive that we really need to look at. So when we talk about all of these things, when scientists, when authorities talk about it, they are not just saying it for fun or to fulfill their work duty. No, they want you to get this information, learn, and make sure that you are protected. So my message here is we need to really take more serious, and I'm speaking to the general public here. We need to take more serious when we receive warnings and information from health authorities globally. Thank you.
Yeah, I agree completely. I feel like maybe in your neck of the woods, people take it seriously. I don't know about here. I think we sometimes, people in other spheres, I'm not talking about health, obviously, but people tend to not necessarily make these connections. And we think like, if you're an influencer, we've been talking about it for probably more than a decade, maybe 2 decades now. And it's this big scare. But I mean, COVID was something or coronavirus was something that we talked about for a long time in the health spheres, and it's come and it hasn't really gone, but it's something that hopefully we've kind of controlled. So I agree, we need to pay attention, not only to maybe war and other alerts that's going around the world, but this is also very important. That affects us on many spheres, not only our health, but economically as well. So thank you, Dauda. I really appreciate our conversation today. And I think we better conclude, otherwise we will talk for hours and we can maybe talk about neglected tropical diseases as well, because that's a very interesting topic, but we'll hold off that for maybe not 3 years' time, but in a few months' time, maybe, if you have a little bit of extra time for us in a few weeks or months' time for that.
Of course, you're always welcome, Julia. It's really nice anytime I get to speak on this space, and I look forward to engaging further through your podcasts and also potentially partnering
yes,
on some other projects that we do. Yeah.
No, that would be perfect. It's so exciting to hear about what you're doing, and I love how enthusiastic you always are about One Health and education. It's fantastic. Thank you so much, Dauda.
All right. Thank you.
Thank you.
If your organization is looking to implement One Health approaches or needs epidemiological expertise, One Life Epi Solutions offers customized consultations to meet your specific needs. Visit our website to learn more at www.onelifeepisolutions.com. And don't forget to join our growing community by following One Health Wednesdays and One Life Epi Solutions on LinkedIn and subscribing to the podcast on Spotify and Apple. Please share this episode if you found it valuable, and together we can spread the One Health message.